12 Secret Symptoms of Type 2 Diabetes. Type 2 diabetes is a chronic medical condition where the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal blood sugar levels. Type 2 diabetes can significantly increase your risk of developing heart disease, stroke, dementia, and vision loss. In this video, we'll be going over 12 signs of type 2 diabetes. Make sure to watch through the entire video, as this condition can be really harmful for your overall health and well-being. Number 1. Increased hunger. Feeling unusually hungry all the time can be an alarming symptom of type 2 diabetes. When your blood sugar is not being used properly by your cells due to insulin resistance, your body craves more fuel to keep up with the energy demands. This leads to frequent hunger pangs, especially after meals. Despite eating, you may still feel like you haven't eaten enough, constantly seeking more food. If this heightened appetite is coupled with other signs like fatigue, weight fluctuations, or excessive thirst, it's important to check your blood sugar levels. Your hunger could be an early indication that your body is struggling to regulate glucose, and addressing the issue now can prevent further complications down the road. Number 2. Irritability and mood swings. Mood swings and irritability are common, especially in times of stress or exhaustion. However, when these emotional changes become frequent and more intense, they could be a sign of fluctuating blood sugar levels. High and low blood sugar levels can both affect your mood, leading to irritability, anxiety, and even depression. The emotional roller coaster caused by these fluctuations can make it harder to cope with daily stressors. If you find yourself feeling more agitated or anxious than usual, it's important to consider the possibility of diabetes and seek medical advice. Balancing your blood sugar can help stabilize your mood and improve your mental well-being. Number 3. Extreme fatigue. Exhaustion is a symptom we often write off as stress or lack of sleep, but persistent fatigue could be a sign of type 2 diabetes. High blood sugar prevents your body from using glucose effectively as an energy source, which means you may feel drained even after a full night of rest. This lack of energy is different from the usual tiredness we all feel from time to time. It's a deep, unshakable fatigue that doesn't seem to improve with rest. Over time, this can affect your ability to perform everyday tasks, and even impact your mental health. If you find yourself constantly worn out, it's worth checking in with your doctor to explore the possibility of diabetes and determine whether your blood sugar levels may be contributing to the problem. Number 4. Unexplained weight gain or loss. Weight fluctuations can be one of the most confounding and frustrating symptoms of type 2 diabetes. Some people with the condition experience unexplained weight gain due to insulin resistance, where the body produces more insulin to try to lower blood sugar levels. Insulin, however, also signals the body to store fat, leading to weight gain. On the flip side, others may lose weight without trying as a result of the body's inability to use glucose for energy, causing it to break down muscle and fat stores for fuel. If you're experiencing unusual weight gain or loss, particularly if it comes with other symptoms like fatigue, increased thirst, or frequent urination, it's important to have your blood sugar levels checked. Early intervention can help prevent the long-term complications of diabetes, including heart disease and kidney issues. Number 5. Blurry vision. Blurry vision can often be one of the first signs that something is wrong with your blood sugar levels, and it's a symptom that many people overlook. When your blood sugar spikes, it can cause the lenses of your eyes to swell, leading to difficulty focusing. At first, you might notice that your vision gets blurry intermittently, particularly after eating. Over time, if blood sugar levels remain high, the problem can worsen, leading to permanent damage to the eyes if left unaddressed. If blurry vision becomes a recurring issue, it's crucial to consult with your doctor to rule out diabetes or catch it early. A thorough eye exam and blood sugar test will help determine if there's a connection between your vision problems and your glucose levels. Number 6. Dry, itchy skin. Dry, itchy skin is another symptom that can sneak up on you, especially as you age. While it's often blamed on environmental factors like cold weather or dehydration, persistent dry skin can also be a result of high blood sugar. Elevated glucose levels can impair the body's ability to retain moisture, leading to dryness and irritation. You may notice that your skin becomes flaky, cracked, or scaly, and regular lotions or creams may not offer the relief you need. Diabetic skin problems can also increase the risk of developing infections. If your dry skin persists despite changes in skincare or climate, it's worth speaking to your doctor about the possibility of diabetes and exploring ways to keep your blood sugar levels in check. Number 7. Gum disease and bad breath. Gum disease and persistent bad breath are more than just an issue for your dental hygiene. They could be signs of type 2 diabetes. Elevated blood sugar levels create a breeding ground for bacteria in the mouth, leading to conditions like gingivitis, inflammation of the gums, and more severe gum disease. This bacteria overgrowth can also contribute to persistent bad breath, known as diabetic halitosis. If you notice your gums bleeding while brushing or flossing, or if bad breath persists despite maintaining good oral hygiene, it's important to consider that diabetes could be the root cause. Managing your blood sugar levels effectively can improve both your oral health and overall well-being. Number 8. Slow healing of cuts and bruises. It's natural to expect cuts, bruises, and scrapes to heal over time, but for individuals with diabetes, the healing process can take significantly longer. High blood sugar levels damage blood vessels, impairing circulation and making it harder for nutrients and oxygen to reach injured areas. As a result, cuts and bruises may become more prone to infection or take weeks to heal. Additionally, poor circulation in the extremities, especially the feet, can lead to wounds that never heal, increasing the risk of severe complications. If you notice that even minor injuries aren't healing properly, it's essential to consult with your healthcare provider. Proper management of your blood sugar levels can help your body recover more quickly and prevent further complications. Number 9. Numbness and tingling. Numbness, tingling, or a pins and needles sensation in your hands and feet are classic signs of diabetic neuropathy, a condition that develops when high blood sugar levels damage the nerves. This nerve damage can be more pronounced in the extremities, especially the feet, causing discomfort, pain, or a loss of sensation. The numbness may start off subtle, only appearing after standing or walking for long periods, but over time it can become a more constant, troubling issue. If you notice any tingling or a loss of feeling in your hands, feet, or legs, it's time to get your blood sugar levels tested. Early detection and proper diabetes management can prevent nerve damage from progressing to more severe complications, like ulcers or infections in the feet. Number 10. Frequent infections. High blood sugar creates an environment where infections can thrive. People with type 2 diabetes have a weakened immune response, making it harder for the body to fight off bacteria and fungi. As a result, frequent infections, particularly urinary tract infections, yeast infections, and skin infections, become a common concern. Infections that seem to pop up without explanation, or that don't heal quickly, could indicate that your body is struggling to defend itself. If you're noticing recurring infections in the genital area, skin, or even in the mouth, consider having your blood sugar levels tested. The good news is that, with proper diabetes management, many infections can be prevented or treated more effectively. Number 11. Acanthosis nigricans. Acanthosis nigricans is a skin condition that causes dark, velvety patches to appear, often around the neck, armpits, and groin. These areas of skin may also feel thicker than normal and can sometimes be itchy. The condition is a sign of insulin resistance, which occurs when the body's cells don't respond properly to insulin, leading to higher glucose levels in the blood. Acanthosis nigricans is more common in people with type 2 diabetes, and if you notice dark patches appearing on your skin, it may be time to get your blood sugar checked. Early detection and proper blood sugar management can prevent the worsening of this condition. Number 12. Hemorrhoids. Hemorrhoids are often brushed off as a minor, temporary issue related to diet or aging. However, they can actually be a subtle warning sign of type 2 diabetes. When blood sugar levels are high, they can interfere with normal blood flow, leading to swollen, inflamed veins in the rectal area. These blood vessels can become stressed and easily irritated, resulting in the painful, uncomfortable condition we know as hemorrhoids. If you find that hemorrhoids are becoming a frequent or painful issue, it's important to have your blood sugar levels checked. In many cases, managing blood sugar can reduce the occurrence of hemorrhoids and provide relief from the discomfort. Those were the 12 signs of type 2 diabetes. Did you know that diabetic neuropathy, nerve damage caused by type 2 diabetes, can be significantly aggravated by deficiency in vitamin B12? Check out this video to learn about 10 signs of vitamin B12 deficiency. Thanks for watching. See you in the next video.